The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, and welcome to today's webinar on homeless crisis response. My name is Christy Greenwald, and I'm the Director of Housing Policy and Research for the United States Interagency Council on Homelessness. I'll be serving as both a moderator and a presenter this afternoon. With me is Barbara Poppy, Executive Director of USICH, and Brett Gagno, Program Specialist and HEARTH Act Extraordinaire from HUD's Office of Special Needs Assistance Programs. With today's webinar, we have 4 key objectives. First, we'd like to review the core tenets of effective homeless crisis response. Next, we'll provide participants with a new framework for thinking about your community's response to homelessness. Third, we'll highlight some new tools and opportunities provided by the HEARTH Act to support this system's change work. And lastly, we'll identify steps that every community can take today to begin this important work. Before we jump in, I have just a few housekeeping notes. The call is scheduled to last 1 hour and 15 minutes. We always encourage folks to dial in through a phone instead of their computer. If you have dialed in through a computer and are having difficulty hearing, there's unfortunately not much we can do to remedy the situation, so please consider, again, dialing in through a landline. All of our panelists will present, and then we'll answer questions at the end. However, you can submit your questions to us at any point in the discussion as they come up. Just type in your question in the questions box found in the GoToWebinar toolbar and hit send. If your question is directed to a particular panelist, please note that when you submit your question. We unfortunately won't have time to get through all of the questions today, but we encourage you to submit any and all questions you have, even more technical or policy-related questions, as that will help us inform guidance and future webinars. Finally, call audience members are muted today due to the high number of participants. We had over 1,200 people register for this webinar. And because of that volume, I just want to acknowledge that sometimes there's a short time lag with the slides. So we'll do our best to keep it moving quickly, but please note that there's just a short time lag. So with that, I'm going to turn it over to Barbara Poppy. Barbara? Great.
Thanks, Christy, and good afternoon to everyone. I think, as you know, in June of 2010, the Interagency Council launched Opening Doors, the first ever federal strategic plan to prevent and end homelessness. I certainly hope that all of you on this call are familiar with it, but just want to remind you that it's a very comprehensive strategy that includes 52 strategies under an umbrella of 10 objectives, and it has 4 very important goals. The first is finish the job of ending chronic homelessness by 2015, prevent and end homelessness among veterans by 2015, prevent and end homelessness among families, youth, and children by 2020, and set a path to ending all types of homelessness. As we start today's webinar, I want everyone to just stop and pause for a moment. I'm asking you, please put down your pen, stop answering your email, close your eyes, and just listen. I've got a story to tell. Now, I want you to imagine a day when, first of all, there are no chronically homeless individuals in your community. Or perhaps you might just see a handful, but they are regularly engaged with outreach staff, and there is housing that's ready and available to them as soon as they decide they want to access it. You also see that there are no unsheltered individuals, and certainly no unsheltered families. You have enough shelter beds to assist those who cannot be helped through your diversion assistance. On that day, you can also note that you actually have far fewer shelter beds than you did at other times in your community's history, because shelter stays are now extremely short. You have become so efficient at administering housing assistance that people are back into housing in less than a month. You have a community-wide system for identifying households, for identifying youth, families, couples, single adults, all of those at risk of homelessness. And through your targeted prevention assistance, you've been able to dramatically reduce the number of these people who have to experience first-time homelessness, as well as the number who experience additional episodes of homelessness. What I'm asking you to imagine and to see is a day when we together have ended homelessness as we know it. I'm asking, can you see it? Do you think it's possible? Well, here at the Interagency Council, we sure do. We've been working with you to develop the methods to do this, and we're encouraging you to transform your local systems from one that manage homelessness to one that quickly and effectively resolves it. We believe it is possible to end homelessness in this country, and the systems change work is the foundation. It's the most important work left to be done at the community level. Within Opening Doors, we have objective number 10, which talks about the issue of homelessness as a crisis, and that it's imperative that we respond to it as such. And that's the focus of our conversation today. Today we're here to talk about how can we transform homeless services to true crisis response systems that prevent homelessness and rapidly return people who experience homelessness to stable housing. Well, before we talk about the system structure, let's talk about the principles that we see of an effective crisis response system. The first tenet is that people know where to go for help and they can easily access assistance. This assistance is client-centric. It's not about the program or the agency. People are able to spend the least amount of time in homelessness possible because the focus is on quickly stabilizing them in permanent housing. Assistance is just enough so we can help everyone. It's just enough to help the client achieve and maintain housing stability. The next slide, as you can see, is what is too often the current state of homelessness in many communities. I think as you may recall, HUD initiated the Continuum of Care process in the mid-1990s. The intent was to stimulate community-wide planning and coordination of programs for individuals and families who experience homelessness. And in many communities, this Continuum of Care concept was implemented as a linear, and in most places a fragmented model, where people experiencing homelessness were expected to progress through levels of care that included emergency shelter, transitional housing, and finally permanent housing. Over the last decade, though, research and practical experience have taught us a great deal. Building on this knowledge, many communities have begun to adopt an approach that focuses on immediate placement into permanent housing. That is, the desired state we're shooting for is a housing-focused system. What that means is for individuals and families that have recently become homeless, the goal is rapid rehousing. And if it's an individual with long histories of homelessness, we've been talking about housing first. The tools and strategies look different for different populations, but the philosophy is the same. Return people to housing quickly and then provide the specific level of assistance and services that are needed by that individual, that family, that youth to remain in housing. A central tenet of this approach is that people have more success dealing with other challenges in their lives, including substance abuse, physical and mental health conditions, unemployment, and family preservation and reunification when they are in their own stable home. While many providers across the country have adopted rapid rehousing and housing-first models, it is our ability to take the concept to scale nationally that will ultimately determine our success at ending homelessness. It's not enough for a few providers in each community to have adopted this approach. We actually need entire communities to embrace this philosophy and restructure the systems around it. And I'm going to turn this over to Christy, who's going to talk about what communities can do to embrace this approach.
Great, thank you, Barbara. Okay, if the old framework is the more linear model of emergency shelter, transitional housing, and permanent housing, the new framework is based on the 3 A's: access, assessment, and assignment of intervention. And as we go through the next set of slides, you'll all see that the components that make up your system are still very much the same. But our goal today is just to present you with a new framework for thinking about how you organize and deliver homeless assistance in your community. Again, one that goes beyond managing homelessness to quickly and effectively resolving it. So I want to start out by acknowledging that the first 2 steps, access and assessment, when operationalized, are highly interdependent. And in some cases, they will occur concurrently. In other cases, they may be iterative, as this slide suggests. However, for the purpose of system planning, which we're really talking about today, we think it's helpful to consider each of these steps independently. Okay, let's take a look at the 3 A's in more depth. So the first A is about access. When a housing crisis occurs, how do people access help in your community? Do they know where to go, and can assistance be provided in time to avoid housing loss and or to avert trauma associated with housing loss? When you think about how you provide access in your community, it's important to consider the various entry points into homelessness so that you can respond accordingly. The most comprehensive approaches will include at least 3 components. First, a way for people that have recently lost their housing to access help. For reasons that we will discuss in a moment, many communities are moving towards a centralized approach, which could include a housing resource center or a 211 hotline. You also need to think about how you are providing access to individuals and families who are in unsheltered locations and who have been unable to enter the system of care. This might be because there are currently no beds available, or because there are mental health and substance use issues preventing them from seeking assistance. And third, how are you coordinating with public institutions such as prisons and hospitals in mainstream or community programs such as schools or TANF agencies to identify individuals and families at great risk of homelessness so they can receive assistance without having to be admitted into shelter? As mentioned, many communities are moving towards a model of centralized or highly coordinated access. There are different models communities consider, each with its own set of advantages, and what works for one community may be different from what works for another community. There are a lot of issues and nuances to consider, so USICH and HUD will be doing an entirely separate webinar specifically on this topic 2 weeks from today. However, for today, it's probably enough to say that every community must be thinking about how they provide access to assistance for people experiencing a housing crisis. The second A in our framework is assessment. We know that assessment is critical. Providers have been doing it for years. But the idea here is around centralized or coordinated assessment, which allows for better targeting. Or put another way, it allows us to match service levels and intensity to each household's unique needs. If you had a chance to read our newsletter yesterday, we talked a little bit about how agencies naturally have a desire to try and help whomever walks through their door. However, if a household has barriers that are quite a bit higher than your agency is equipped to deal with, your efforts will be less effective. And in contrast, if households walking through your door have fewer barriers than your program is designed to deal with, it may end up being a less efficient use of your local community resources. This triaging can be challenging to pull off when it's left up to each individual provider. It's hard to maintain a big picture systems perspective, and it can lead to people falling through the cracks as they get referred from one agency to the next. But when this assessment is done at the front door of the system, it can help you use your limited resources to help as many people as possible. As mentioned earlier, access and assessment are highly interconnected and at times even iterative. When you think about assessment, it's important to understand that there are different levels of assessment that might occur, all of which depend on an individual's circumstances, needs, challenges, and assets. If you think back to the tenets of crisis response, you will recall that Barbara said that one of them is that the assistance is client-centric. We are trying to make programs and services work for clients wherever they present and whatever needs they present, not the other way around. So one level of assessment that occurs is to determine whether prevention or diversion is an option. This requires staff that are very savvy at problem solving and very familiar with the range of resources available in the community, particularly mainstream resources and benefits. They need to have real referrals that can be linkages and the ability to follow through with problem solving support. When prevention or diversion is not possible, the next level of assessment is to determine where the individual or family can stay while they are working on resolving their housing crisis. This level of shelter placement, this level of assessment involves understanding your community's bed inventory and current capacity, eligibility requirements, location needs, that sort of thing. And the last level of assessment is a more comprehensive assessment to determine the rehousing strategy. What level of assistance does the household need to obtain and maintain permanent housing? The value of centralized approach is the specialization required to be successful at these 3 different types of assessment. If your community chooses a decentralized model, it is still essential to have a common assessment tool and referral protocols. Additionally, each agency must have staff that have the time and knowledge to handle the assessment, diversion, and placement in a timely manner and make impartial decisions. And lastly, it's important to mention that use of a common assessment tool applies for street outreach for street outreach workers as well, though the tool may be different. For example, in the form of a vulnerability survey, which helps prioritize placement into permanent supportive housing. And the last A in our new framework is the assignment of the permanent housing intervention. For example, prevention to keep people in their own homes, rapid rehousing or transition and place models for those who will be able to maintain stable housing with only a short-term subsidy in services, affordable housing for those that are likely to need an ongoing subsidy of some sort, and permanent supportive housing for those that need an ongoing subsidy in intensive, long-term wraparound services. It's very important to underscore the need and urgency of services in this rapid rehousing and housing first environment. As we transition from a system where the focus has been on preparing people to be placed in housing under a housing ready approach to this housing first model, the focus needs to be on what services are needed to keep people in housing. Clearly, different households will require different type and level of services, and again, that type of targeting and triaging is critical to make sure that we can use our limited resources as effectively and strategically as possible. And in this current budget environment, everyone has heard us say over and over again that it will be essential that we think about how we better access mainstream resources to help provide those services. One question that we've received a lot concerns the role of shelter under this new rapid rehousing and housing first framework. So I want to take a moment to address that issue. Unless access to affordable housing is widely available, it simply would not be realistic to expect to prevent all crises that lead to homelessness. So with that, there may very well always be a need for shelter. Simply put, people need a safe and secure place to stay while searching for permanent housing or waiting for placement in permanent supportive housing. However, as communities establish efficient housing search and placement strategies and become increasingly sophisticated at administering rapid rehousing and housing first assistance, you all will be able to reduce the amount of time people spend in shelters. This means that people will move through shelters much more quickly, which means you may need fewer overall shelter beds. Now, clearly some communities have large unsheltered populations and may actually still need additional shelter capacity. However, it's important that everyone use the data that they've been collecting and do some modeling to understand how changing lengths of stay can impact your needs. It's also very important to consider what type of shelter is needed: family, adult individuals, youth, low barrier shelter. So again, shelter continues to play a very important role in this new model, but it's a different role. And one other observation on the role of shelters in this new framework: in some communities, shelter providers are adding housing search and placement services, housing stabilization services as key program components, and in other communities, they have found it more effective to have separate agencies that specialize in housing search and stabilization and co-locate within the shelters. Okay, and one last concept I want to introduce before I turn it over to HUD is that of right-sizing your system. Similar to how we sometimes talk about right-sizing services or matching services to an individual's needs, right-sizing the system refers to thinking about the optimal investment mix of interventions in your community. So how much shelter do you really need? How much single-site transitional housing do you need? How many rapid rehousing slots? How many permanent supportive housing units? So to get started, you need to analyze your data. Which programs are effectively meeting needs in your community? Which programs may need to be modified or repurposed? And what gaps exist? Ideally, this analysis is community-wide, not just an analysis of HUD-funded programs, and this will become increasingly possible as other targeted programs begin use of HMIS. Okay, so what are some questions that you can ask yourself? What are pieces of data that you should be looking at as you start thinking about right-sizing your system? The first aspect is around program utilization. Do you have, for example, programs with empty beds? And at the same time, do you have unsheltered homeless individuals and families? If that is the case, there's clearly a disconnect. Either additional outreach services are needed, or eligibility criteria for certain programs is too high. So you need to think about, are your existing programs meeting the needs within your community? A second thing that communities will want to increasingly look at as they implement diversion programs is the diversion rates. So who and how many people are being diverted? Do those folks eventually end up in your system, or do they remain stably housed? And if you are able to successfully divert households, what impact might that have on lengths of stay in shelter? If you are successfully diverting households that have lower levels of barriers and needs, your length of stay in shelters may actually increase. So it's important to sort of think about these issues from both sides and understand the impact of becoming more efficient with diversion and prevention, and what impact that has with the folks that ultimately end up in the shelter system. Another aspect to look at relates to program outcomes, of course. How are programs doing placing people into permanent housing? What's the average length of stay in those programs? What is the housing retention and recidivism rate look like for the clients that they serve? So in fact, are similar programs who are targeting similar populations, are they having similar outcomes? And then, of course, cost effectiveness. We've spent a lot of time talking about the great importance of looking at cost effectiveness in this budget environment. Needs in our communities significantly outpace available resources, so we need to think about which resources are giving, or which interventions are giving us the most bang for our buck. So what's the average cost per household served, and what's the average cost per placement in the permanent housing? Because, of course, a household being served isn't necessarily a positive outcome, so we need to look at how much it's costing an agency to get that positive outcome. Okay, so now that you have a sense of data that you should look at, the next question, of course, becomes, so how do you actually get there? And again, everyone knows, as I mentioned, in this budget environment, we really cannot expect significant infusions of new federal dollars anytime soon. So it really becomes all the more critical that we use every last opportunity that exists. And on this slide, we're presenting you with a few ideas around opportunities to begin right-sizing your system. The first is, of course, repurposing existing programs. So that may involve making modifications to an existing program model or program design to make it more effective. So within your existing program portfolio, are there ways to shorten length of stay, to transition from more traditional transitional housing programs to a transition in place model, so that households are being moved into a permanent housing right away with services and transitional assistance following. So there are some ways to think about how you can tweak program models to increase their effectiveness. The next opportunity is the reallocation of continuum of care funded programs, and Brett will talk a little bit more about that in her presentation, but in short, during every continuum of care competition, continuums have the opportunity to reallocate funds from certain programs to other types of programs with the rules established in the NOFA each year. The Affordable Care Act with Medicaid expansion, of course, provides great opportunities in the months and years ahead to transition some of our service costs over to that portion of the system, so we can use housing resources to pay for housing. And of course, if folks have probably recognized that we've been increasingly focused on how to partner with public housing agencies to increase opportunities for additional permanent housing options in your community. So again, how can you bring public housing agencies and other affordable housing providers to the table? And last but not least, of course, leveraging private sector involvement, particularly property managers, foundations, business sector. There's a lot of folks that can play an important role in this system, and they should all be at the table. So the last thing I want to leave you with is just to remember simply that systems change is a process. It's not a single event. It happens over time, and it will require everyone doing their part. And with that, I'm now going to turn it over to our colleague from HUD, Brett Gagnon, who will talk about the incentives and opportunities for system change created by the HEARTH Act.
Thank you, Christy. Good afternoon, everyone. On behalf of Anna Leva, Director of the Office of Special Needs Assistance Programs, I want to thank you all for joining us today. She really wanted to be here as homeless crisis response is integral to implementing the HEARTH Act programs, but she had a scheduling conflict. Hopefully I can be just as helpful to you as she would have been. As Christy just mentioned, systems change is a circular process that must constantly be repeated to be effective. It consists of planning for the change, implementing it, evaluating the effectiveness of the change, and determining next steps to continue the change. HUD encouraged communities to begin this process in September 2010 at our conferences in Atlanta and Denver to begin to prepare for the implementation of the HEARTH Act. During this time, we stressed the importance of having all of the stakeholders around the table to have this conversation and encouraged you to take the tools and resources you acquired at the conferences back to your communities to assist with those conversations. And now we're at the time where we've just implemented the first of our rules for effect to implement that change. The homeless definition was released as a final rule. I'm going to give you just a quick update of where we stand. On December 5th, 2011, it applies to the Emergency Solutions Grants Program and SHP and Shelter Plus Care Grants funded in the fiscal year 2011 competition. Generally, it broadens the populations of individuals and families defined as homeless under HUD's definition, largely by codifying individuals and families that we have always allowed to be served in supportive service only and transitional housing projects. This definition will be incorporated into the COC program and the Rural Housing Stability Assistance Program. The ESG regulation was released as an interim rule on December 5th, 2011 as well. This is the first of the regulations that will provide the resources and tools to communities to begin implementing their systems change, primarily by funding rapid rehousing and homelessness prevention, which we will discuss in a moment. Additionally, the amount of funding provided to the ESG program was increased by $90 million in fiscal year 11 to give communities additional resources to implement the new activities, and was further increased in fiscal year 12 by $36 million to $286 million nationally. As communities implement the interim regulations, HUD will be reviewing the comments received and preparing a final rule to respond to the public comments. Congress instructed HUD in its fiscal year 12 budget to publish the Continuum of Care and Rural Housing Stability Assistance Programs as interim regulations. Therefore, we expect that they will be used to administer the fiscal year 12 COC and rural housing competition. This will be another opportunity where communities should evaluate their systems and assess the new funding streams to determine how they can effectively use the tools provided through these systems of funding to further systems change in their community and get to the day where we end homelessness as we know it. One major tool that will be available to communities through the COC program is reallocation. It allows communities to repurpose their systems. Please note, as Ann mentioned in her listserv message yesterday, former Shelter Plus Care projects, their funds will now be eligible to be included in the reallocated pot. Finally, data collection and evaluation of the data collected is a large component of systems change. To help support this, HUD is publishing the HMIS regulation to update the HMIS requirements and ensure communities have a secure system in place that can collect the data needed to measure the effectiveness of their homeless crisis response system. This is important locally, but will also be necessary to meet the performance measurement standards required in the McKinney-Vento Act as amended by the HEARTH Act. Because the HMIS rule was published as proposed, these requirements will not go into effect until it's published as final. In the interim, communities should continue to use the standards currently in place, the 2004 technical standards and the 2010 data standards. As Barbara mentioned, in 1994, HUD began administratively phasing in the continuum of care concept through its NOFAs. HUD encouraged communities to address homelessness in a coordinated and comprehensive manner. Traditionally, communities that use the continuum of care to strategize and coordinate all of their McKinney-Vento homeless assistance resources, including ESG, as well as other mainstream resources, have received higher scores and received more funding. The HEARTH Act codified the continuum of care process into regulation and requires that communities coordinate their McKinney-Vento resources through this body of key stakeholders. HUD intends to use the continuum of care regulations to provide communities with a lever to implement effective systems change locally, but does not intend for communities that have an effective structure in place to have to implement wholesale change. HUD recognizes that communities need flexibility in order to best meet unique local needs. As HUD has evaluated its own programs, we recognize that centralized or coordinated assessment is necessary for the federal strategic plan to work and for HUD to maximize its resources. If your community carries out centralized or coordinated assessment correctly, then it will impact how the individual or family is assessed and deemed eligible for services, and ensure that they are placed in the intervention method that provides the level of housing and services most appropriate to their needs. And it will also affect how these individuals and families flow through the system. The centralized or coordinated assessment system can also guide conversations about how funding streams within a geographic area can be combined effectively, preventing overlap, so that all of the needed housing and service elements are available while making the most of federal and local dollars. The centralized and coordinated assessment system, like the continuum of care, is a system that is intended to address the needs of homeless individuals and families with resources beyond the McKinney-Vento Homeless Assistance Program. Through the COC NOFA and annual competitions, HUD has set forth components of a homeless crisis response system. These elements remain the same and are summarized over the next several slides. The change will be in how communities think about these elements and utilize them locally. The first three are outreach, shelter, and rapid rehousing. Obviously, these components of the system were not allowed to be funded under the Supportive Housing Program or the Shelter Plus Care Program. From early on, HUD expected that continuums would be used to coordinate and collaborate with other sources of funding to ensure their response system included these elements. HUD recognizes that this happens differently in all COCs. This slide provides the remaining elements of the response system: transitional housing, permanent housing, and homelessness prevention. HUD anticipates that the continuum of care will continue to be responsible for the systemic planning in the upcoming COC regulation, and will be required to pull together the necessary stakeholders and funding streams to ensure that the needs of homeless individuals are met within the geographic area. The McKinney-Vento Act, as amended by the HEARTH Act, supports this framework as it requires continuums of care to measure performance at a system-wide level, specifically including the performance of projects funded with Emergency Solutions Grant Funds. Over the next several slides, we will discuss the array of current homeless McKinney-Vento resources, as well as those that will become available to communities through the implementation of the ESG program and the COC program. While the continuum of care provides the framework for the planning and the body of stakeholders, it is critically important to recognize that it is only one stream of funding through which homeless individuals and families may be served. Through its revisions to the Emergency Shelter Grants Program, the ESG rule specifically recognizes street outreach as an eligible component. While always eligible under the Emergency Shelter Grants Program as an essential service, by explicitly recognizing the use of funds for projects that fund street outreach, we have more explicitly recognized it as a component of the system. The activities have been limited to those that are necessary to provide crisis intervention, to engage individuals and families, and to link individuals and families to emergency shelter and/or housing. This is in line with the general goal and emphasis of the ESG program, which is to place people into permanent housing as quickly as possible. The Emergency Solutions Grants Program continues to fund emergency shelter, However, the ESG regulations limit funding of emergency shelter and street outreach. This ensures that the majority of new money allocated to the ESG program will be used for the new strategies, rapid rehousing and homelessness prevention, which we will discuss momentarily. Assistance for rapid rehousing under the ESG program provides funding for rapid rehousing very much like HPRP, short-term and medium-term rental assistance, and housing relocation and stabilization services. You will note that HPRP was not listed as a resource in this presentation. This is because for many communities, 100% of HPRP funds have been spent. For all other communities, the funding will no longer be available after September 30th. Because of this, Secretary Donovan is encouraging communities to invest highly in rapid rehousing with their ESG funds. Data from HPRP show that we can make a bigger impact by targeting funds to rapid rehousing, helping those who have just fallen into homelessness obtain permanent housing quickly. A link to Secretary Donovan's message can be found on the HUD Homelessness Resource Exchange. Rapid rehousing is an intervention strategy that we know works. The second allocation of fiscal year 11 funds is the first time jurisdictions could begin using ESG funding on rapid rehousing as an intervention. HUD strongly encourages communities to review what worked and what didn't in their HPRP program and target their programs accordingly. HUD anticipates this model will be allowed under the Continuum of Care program because the statute allows funding to be used for rehousing services as well as rental assistance or leasing. With more than one McKinney-Vento Act program funding a particular intervention strategy, it is crucial that recipients of funds highly coordinate these services to ensure that there is no overlap and individuals and families are assessed consistently for the same service across the same geographic area. This is where centralized or coordinated assessment will be crucial. Transitional housing is an element that the Continuum of Care program will continue to fund. We're not going to spend a lot of time there, though. We'll move on to permanent supportive housing, which is an effective intervention for those individuals with disabilities that impede their ability to obtain and sustain housing independently without support, including those families who have an individual member with a disability. The SHP and Shelter Plus Care programs currently fund permanent supportive housing, and while the McKinney-Vento Act, as amended by the HEARTH Act, specifically allows for funding of permanent housing with and without supportive services, the intent to continue funding PSH is clear because it requires that not less than 30% of funding nationwide be used for permanent housing for homeless individuals with disabilities and homeless families with a disabled adult or a minor head of household. Homelessness prevention. It has always been allowed under the Emergency Shelter Grants Program. However, the ESG program clarifies the eligible activities, short-term and or medium-term rental assistance, and housing relocation and stabilization services, like HPRP. The ESG also provides a clear definition of at risk of homelessness and significantly increases the portions of ESG funds that could be used on homelessness prevention. As we have mentioned, Secretary released a message to ESG recipients encouraging them to use the increase of funds in the FY11 and FY12 budget on rapid rehousing instead of homelessness prevention. While homelessness prevention is a helpful strategy in many communities, its effectiveness has not been proven. Therefore, HUD is encouraging use in rapid rehousing. Additionally, HUD's McKinney-Vento homeless assistance programs continue to be the only housing resources dedicated to individuals and families who are homeless. While many other programs offer incentives for homeless individuals and families, those programs primarily service individuals and families at risk of homelessness. HUD encourages communities to leverage those resources to serve persons at risk of homelessness in their community and coordinate them through the COC, but to save ESG and COC dollars to serve those who are defined as homeless. The COC program does allow continuums that have been designated high-performing communities to use funds on homelessness prevention. However, this will not be available to communities in fiscal year 12 as HUD cannot implement high-performing communities due to lack of data needed to appropriately evaluate COCs. So what you'll see is that those are the 6 elements that have always been part of our system, and what we're adding as a 7th element is centralized or coordinated assessment. What you just saw is that the components funded through the ESG and COC programs are similar to existing programs. The centralized or coordinated assessment system is meant to help reorganize how you deliver homeless assistance in your community and help individuals and families access housing and services at the most appropriate level, diverting them from stays on the streets or in emergency shelter whenever possible and placing them quickly in a permanent housing solution.
Great. Thanks so much, Brett, for joining us today. Before we move on to questions, we wanted to just give you all a few steps that everyone can take to get started today. We know that systems change is daunting work, and thinking about where to even begin can actually be a little immobilizing, but we think there are some steps that every community can take right away to get started. So here are a few ideas. First, of course, as I mentioned earlier, it's important, actually imperative, for everyone to get started on their data analysis. And honestly, there's no better way to improve the quality of your data than by starting to use it. You may not have all the answers you need, but you will have some of them, and you will quickly learn where you need to do more work to improve your data quality. A second step everyone can take is joining the 100,000 Homes campaign and getting started on your registry. The 100,000 Homes campaign is built upon the principle of effective targeting of the relatively high-cost permanent supportive housing interventions to those who need it most. So for folks who are working on the chronic side of the system, we feel strongly that having your list, your registry, and sort of getting started on that piece is very important work. The next idea is to form a task force to start planning for coordinated access and assessment. Again, there will be a lot of thought and effort and community coordination and negotiation and buy-in that will be required to move in that direction. So certainly begin that work today. And do a partnership analysis. Who's part of your planning process? Again, our public housing agencies at the table, our youth providers, is your local education liaison. In an effective system, everyone has specific roles to play based on their resources and areas of expertise. Everyone has specific contributions to the system. However, to incent participation and collaboration, everyone also needs to benefit from this partnership. So take some time to think about who's missing from the table and what benefits they get by participating, because you'll need that to do that sales work. And review your community's plan and update them with specific goals, action steps, and timelines. And lastly, progress starts with a common vision. So make sure that everyone within your community understands what you are driving towards. It's absolutely essential that every agency, every partner, every staff person within those agencies understand the vision of where we're driving towards in the future. And as with all webinars, we like to point you in the direction of additional information. USICH has put together a toolkit of some of the most useful resources we have found on this topic. So this topic is, of course, broad and encompasses rapid rehousing, housing first, diversion, the role of shelters, centralized and coordinated intake. Again, this is really the foundation for everything that folks are doing at the local level. But some of the most effective resources that we have seen, we've put them together in a toolkit, which you can find on our website. And of course, visit the HUD HRE for the latest information guidance, and guidance on HEARTH implementation. At this point in time, we have quite a bit of time for questions, so we're going to try to tackle a few of the great questions that everyone has submitted to us. So the first question I'm going to pose to Barbara. One participant pointed out that while everyone would like to see households in permanent housing, there is a significant shortage of affordable housing in communities. And this user pointed out that emergency shelter and transitional housing are options for housing people now, today. So can you talk a little bit about the role of transitional housing in this new framework?
Great. Christy, that's a question I get as I travel across the country. And one of the things I've seen across the country is the line between what is emergency shelter and what is transitional shelter or transitional housing is very, very fuzzy. And I think what communities have come to realize is that the greatest value that comes from emergency and transitional shelter is it's an alternative on the interim basis to folks being on the streets. What progressive communities are realizing is to take that resource and use it to really focus on all of the resources to get folks more quickly into permanent housing. And so doing the kind of services that help them locate affordable housing, help them connect with the income that will make it possible for them to get in it, so that the stays in emergency and transitional shelter or transitional housing are as short as possible. Some communities have even gone so far to increase their housing stock by transitioning their transitional housing through a transition in place model. Really good news on that front is that the VA has just released a new set of requests for proposals to transition their transitional housing program, known as the Grant Per Diem program, or GPD, using the very successful transition in place model. And so communities are working to do that as well because it can increase the supply of affordable housing in the community. There also are some, perhaps some really specialized purposes for emergency and transitional shelter that deal with specific population needs. Again, those should be very short-term resources where the focus is really on rapid rehousing folks. We know folks will do so much better in dealing with their educational deficits and finding a job and getting clean and sober, getting mental health services that they need if they're actually in permanent housing. And so when we think about the tremendous resources across the country which now are invested in emergency and transitional housing, if we can leverage those and focus on permanent housing placement, we believe will expand the supply of permanent housing and more quickly get folks off the streets and into a stable place to stay.
Great, thank you, Barb. The next question I'm going to pose to Brett. There's sort of a couple of related questions, so you may be able to address them together. One participant is asking for more detail on funding, the funding options for outreach, shelter, and rapid rehousing, and another person is wanting to understand what funds are available to create centralized and coordinated intake.
Both really great questions. Street outreach is currently funded through the SHP program as a supportive service-only program, and we intend that it will continue to be funded through the COC program as it allows for supportive services to be provided to persons who are homeless. It's also explicitly funded under the new Emergency Solutions Grants program, but you will note that the funding to street outreach and emergency shelter is limited, and this is through strategies. Rapid rehousing is explicitly allowed under the new Emergency Solutions Grants program, and because the COC program in the statute says that it will fund rehousing services and then rental assistance or leasing, which is the housing portion of the services, we expect that it will be funded under the Continuum of Care program, and we hope that it will be as consistent as possible, as that's been one of our goals through the rules, is to make all of the rules consistent where they can be to help ease administration at the local level where programs really look alike. Funds will be available to both establish, operate the centralized or coordinated assessment system, and also for intake workers who are using the centralized or coordinated assessment system. In the Emergency Solutions Grants program, you'll see it's an eligible cost under case management, and we anticipate that the funds that are available for COC planning, obviously having a centralized or coordinated assessment system would be critical to planning COC resources, and so we anticipate it will be eligible under COC planning as well.
This is Barbara, and if I might add that there are other federal sources and local and state sources that can be used to fund outreach. Outreach is a really important activity, but what we often see in communities is that outreach is disconnected from the housing placement system, and often there are disconnects amongst the various outreach providers. So for sources of funding, though, you might look to your runaway and homeless youth programs. They are able to access youth outreach grants. The PATH program, which is a block grant that goes to state governments intended to help homeless individuals with mental illness. Those resources are made available through the state government to local communities. The Healthcare for Homeless Veterans is an outreach effort by the VA. And these outreach staff can be actively working with you in your local community to do outreach to veterans and get them connected to the VA services for which they're eligible. Another HHS initiative is through the Healthcare for the Homeless. This is part of the housing, let me say that, the HRSA, HRSA, the Health Resources Administration, get that acronym right there. And they, the Healthcare for the Homeless grantees also are able to do outreach and on a funded basis. There also are states and local governments which provide either direct staff or provide grants related to outreach and engagement for folks, particularly for special populations. And then in some communities, I've even seen that there are local outreach provided by the actual police department or the city government, where they hire and engage outreach employees in order to conduct the community's outreach approaches. So we really encourage communities to look broadly at how outreach is currently being funded and currently being utilized, and then also look for those new resources that if you do need additional outreach services. But at minimum, you want outreach to be connected to getting folks directly off the streets and into their housing rather than sustaining them in the streets. So good stuff is possible out there if you're strategic in how you access resources.
Great. Thank you, Barbara. We're receiving a few questions around the most effective way to implement a single point of entry or coordinated entry. Folks are wondering about the different models and if we can give examples of communities that have used different models. And I just want to make sure that folks, again, remember that we're doing an entire webinar on this topic 2 weeks from today on Tuesday the 20th. There's a lot of content to cover here, so instead of trying to address it quickly in a 2-minute response, just want to encourage you to sign up for that webinar, which we will, again, be hosting with our colleagues at HUD. Also point out that the National Alliance has done quite a bit of work around this topic, and they have papers and webinars that are available on their website, so you can take a look at those in the short term. But again, definitely more to come on that. Another question for Brett is around solutions for getting service providers to use their HMIS consistently. So do you have any thoughts on that?
So I will note that using HMIS is now a requirement for ESG recipients, and this should help bring emergency shelters in many communities on board. Training on HMIS is crucial, educating providers on the benefits of using it regularly as well as the security of the system. It's an eligible cost within the HMIS component of the ESG rule and should be under the COC rule. Training them what the data means, how it's used. But one of the most effective ways to bring agencies in your community on board and to get them to use the HMIS consistently is to use the data locally. Set local goals that are meaningful to your community and that you regularly measure and visit your communities to make sure they're putting the exit and entry dates and that your data quality is high so that your local goals are measured effectively. Also, placing the requirements in contracts for the use of local funds helps as well for those agencies that are receiving local funding. Those are some of the ways that we have found communities have brought agencies on board consistently.
Great. Thank you, Brett. Another question for Barb. Are there best practice assessment tools to determine the level of services needed?
I think this is an interesting question because if there was a tool that everyone could use across the country and magically be able to do the right assessment, it would be great to provide that. What I've observed across the country is the best assessment tools are the ones that work in your community and are focused on achieving each of the steps that Christy described in her presentation. That said, there probably are some communities that have developed these assessment tools, and I think as Christy noted, they are available out of the National Alliance on Homelessness. There's been a lot of coverage of the tools being used in Minnesota at Hennepin County as well as in Columbus, Ohio. And then there's a whole set of tools that were developed and rolled out through the HPRP implementation. So we encourage communities to pick them up. I think the most important thing is to create the tools and protocols that will work locally in your community and provide staff training so that staff actually know how to use them. We know in the homeless services sector there's a lot of staff turnover, and a tool won't get you there. What does get you there is actually well-trained staff who are aware of the resources in the community. And that requires that programs as well as the community at large make those resources available and are shared and networked, because we really want to get people who are experiencing or at risk of homelessness connected to both the community programs that might help them as well as the mainstream programs. And that requires a level of understanding the resources in your community and an ability to, when you make those assessments, to actually get folks linked up to the services that are available in the community. And getting them, as Christy said, the right amount of assistance at the right time will make the most difference.
I would also add to that, we've seen some assessment tools that are particularly comprehensive, which is good, but then clients end up having a service plan, so to speak, for 20 different areas of their life where they need to make changes, and that is probably not realistic for anyone, much less people that are in the middle of a housing crisis. So again, the assessment really needs to be focused around the issues and challenges that are preventing housing stability, knowing that people can really only focus on one or two things, and in particular, one crisis at a time. So again, this is a little bit of a change from the past where communities focused on a housing-ready approach and really addressing every barrier a household or individual had, and it's really thinking about specifically what are the barriers to obtaining and maintaining housing. So, Brett, I have a question here around training on the Emergency Solution Grants Program. It said, will there be training available on that program? And if I'm recalling correctly, you guys already have done quite a bit of training and guidance on that?
We have. We've done several webinars, which you can find the archives on the HUD Homeless Resource Exchange. We've posted some one-pagers for the definition of homeless and at risk of homelessness, which also apply to the Emergency Solutions Grants Program. And we are planning on rolling out more training. Just encourage you to sign up for our listserv so that you know when we're going to host it and can register.
And then another HEARTH-related question, Brett. Which programs must use the new definition? And so in particular, the person is asking about programs that were funded under previous competitions. Can you talk a little bit about that?
Mm-hmm. The new definition of homelessness, it goes into effect for the Emergency Solutions Grants Program. So it starts on the formula program with the second allocation of fiscal year 11 funds. But I think most people are most concerned, how does it apply to SHP and Shelter Plus Care? And the answer to that is it applies to those projects that were new or renewal projects funded through the fiscal year 11 competition. And what that means is it goes into effect on your operating, the date your project starts operating for that year. So for a project that goes in, that starts operating, has an operating program year of September 1st to August 31st, you start using the definition on September 1st. And that's because your current programs have the current regulations attached to them, and that includes the old definition of homelessness. So you aren't able to start using it until you implement the program that was renewed or new under the fiscal year 11 competition.
Great. Okay, well, it is now 4 o'clock on the East Coast, and we want to make sure that we get folks out on time. So I think we will close down for this afternoon. The webinars will be posted on the USICH website by early next week, and I believe on the HUD Resource Exchange as well. On behalf of my colleagues here at USICH and at HUD, we want to thank everyone for your participation in today's webinar, and more importantly, thank you for your hard work in the field. And as always, we appreciate your partnership, and again, thank you for the effort. So good day.